Hi, I'm Dr. Barry Gillespie. I practice in the King of Prussia Medical Center in King of Prussia, Pennsylvania, the United States of America. And today I'm going to talk about CFT and brain injured children. In 2003, I became on the staff with the Family Hope Center in suburban Philadelphia. Carol and Matthew New were kind enough to ask me to join their group, and they became so excited about CFT that Carol and Matthew took the seminar in April of 2004, and they got so excited about it. I said, everybody in the staff has to learn. So I've trained everyone at the Family Hope Center how to do my work. So it's been very rewarding, and it's truly an international center. And I was been fortunate enough to be there for so long that the parents gave me some very, very nice gifts. They were appreciative their children had therapy. And these are parents from Denmark. These are parents from France. These are parents from Hong Kong. And these are parents from Beijing. So we see children from around the world, and that's what we'll be discussing in this segment. Common conditions are cerebral palsy, epilepsy, Down syndrome, autism and spectrum children, ADHD, and genetic issues. The craniosacral fascial system is a system I discovered about 20 years ago. And there are two components to it, the craniosacral aspect and the fascial aspect. The craniosacral is the brain breathing, where the brain slowly expands and slowly contracts. And it's this expansion and contraction, we call it a brain cycle, where the brain is actually breathing. The sacral aspect is the tailbone, where the tailbone, when the brain expands, the tailbone will go into flexion. When the brain contracts, the tailbone will go into extension. So I have this little toy here. And when a mother comes in with her child, and the child is usually very, very tight, and the cycle may be 0, where there's no expansion, no contraction, the ultimate goal over a series of visits to have a slow expansion of 100 seconds, where the brain is really opening up, it's calm, it's relaxed, and the brain slowly contracts 100 seconds, where the brain is very relaxed and very calm. So this whole brain cycle is around 200 seconds. So again, when the brain is expanding like this, the sacrum of the tailbone will go into flexion. When the brain is contracting, it will go into an extension. And it's this craniosacral cycle that allows the brain and spinal cord to move freely. The other aspect of this is the fascial web, the connective tissue web. It's the web from head to toe, finger to finger. It surrounds every muscle cell. It goes into every organ. It goes around every nerve. It goes around every blood vessel. It goes into the eyes, the teeth. It keeps our body in structural alignment. It gives us tensegrity. The only problem is that if there's trauma, it can create strain in the system. And if there's strain in your neck or pain in the neck or in your eye or whatever, it can cause issues in our bodies. And this is what we're dealing with in craniosacral fascial therapy. These children are very unique in one respect because every child that we've seen at Family Hope has had a 0 cycle. When they came in, there was no expansion, there was no contraction, there was nothing. And it was usually attributed to one specific trauma. Something usually happened at birth or somewhere in their lives. And these are small children. Somewhere in their life, they had trauma and they got tight. So usually there's only one trauma in there, so once you start doing therapy and the brain starts to breathe and the fascia starts to open up, we can usually get these children to maybe 60 or 70 seconds at the first visit. And then the second visit they may go to 80 or 90 or even 100 seconds. So the amount of therapy for these children, and generally speaking, is not long because they're usually just this one injury, rather than having a 10-year-old who's had 27 injuries. He fell off his bike, he fell out of a tree, and all the things that children do. And that's my feeling about the brain injured children. Once the system starts to open up, it can work beautifully and start the healing mechanism right away. The preventative aspect of work would be huge for a brain injured child. And let me describe that. Let's say a brain injured child might be one birth out of 100. And I don't know if those are the numbers, that I'm just saying 1 out of 100. So 99 of the births are going to be fairly normal, maybe difficult, but there's going to be no brain injury. But it's going to be that 100th baby. That 100th baby may have an issue. And it's that baby that we're most concerned with. Well, when you're 5 minutes old, nobody's going to diagnose you, oh, you have cerebral palsy, or you have seizures, or you don't have anything. I mean, but with a baby brain score, what we can do is we can say if there is restriction or difficulty in the function of the brain. So once that score is recorded and it's not up to par, we can start CFT or therapy right at birth. And it would be I believe it would be a huge thing for the brain injured children. Because you can get the healing started right away, where if instead of waiting until they're years old to have cerebral palsy or seizures or Downs or whatever they have, it can be mitigated right at birth. And that's the beauty of it, where that child can have therapy when they're 10 minutes old, a few hours later that day, all through the next day, until the child is strain free. I think that would be a huge thing. And what we were thinking was that it would be a situation where if you had moderate brain injury at birth, it may be significantly mitigated, where you are showing, when you're an child, very, very few symptoms or no symptoms at all. Or if you were severely injured at birth, a lot of that can be mitigated, where you do a lot better later in life with epilepsy or cerebral palsy. In medicine, there's a term called a golden hour, and it's the best result possible can be attained within the hour after the trauma. So if there's been severe trauma at birth and your baby, which you don't even know is brain injured, it's that golden hour of therapy at birth that can really, really help your child. And even though it might be one birth out of 100, we feel it should be done for every child. Every child needs to be checked, especially the brain injured child. Thank you.